home health agency owners, directors of nursing, and clinical leaders. Does this sound familiar? It's 9 p.m. on a Tuesday night. Your best nurse is still sitting at her kitchen table, finishing OASIS documentation for patients she saw hours ago. She's exhausted. She's frustrated. And she's updating her resume. Your agency's turnover has crept up past 60%. And every exit interview says the same thing. I didn't become a nurse to do paperwork. You've invested thousands in EMR systems that promise to make documentation easier, only to discover they just digitized the same 3-hour documentation nightmare. You're watching skilled clinicians burn out, leave the industry entirely, or defect to competitors who somehow figured out how to make this bearable. Your clinical directors spend more time chasing incomplete assessments than actually improving patient care. Yet, you can't help but notice that some agencies have somehow cracked the code. Their nurses finish documentation during the workday. Their turnover is half of yours. Their clinicians actually seem happy. So, what do they do that you haven't figured out yet? Imagine if your nurses could complete a full start of care assessment in 15 minutes instead of 3 hours. Imagine if OASIS documentation happened almost automatically, pre-populated from the referral, refined during the visit, reviewed with a few quick taps. With that kind of efficiency comes freedom. Your ability to finally retain your best clinicians. Stop the revolving door of hiring and training and building an agency known for exceptional care instead of exceptional paperwork. Your nurses get their evenings back. Your clinical directors focus on quality, not compliance firefighting. Your agency becomes the place talented clinicians actually want to work. Ready to live this life? You're about to learn how. First, the bad news. Even though thousands of home health agencies will try to reduce their documentation burden this year, very few will succeed. The truly lucky ones will free their nurses from the paperwork prison, cut turnover in half, and build teams that stay for years instead of months. But nearly everyone else will keep losing their best people to burnout, watching documentation pile up after hours and wondering why they can't seem to fix what's clearly broken. Maybe it's even happening to you already. You started your agency to provide exceptional patient care, but you ended up running a documentation factory where nurses spend more time typing than healing. Or perhaps you try to solve the problem, investing in a new EMR module, hiring scribes, implementing documentation improvement initiatives, only to end up with the same burned out staff and same 3-hour start of care. You end up feeling stuck, watching good nurses leave, knowing the problem but not seeing a real solution. And sometimes it feels like no matter what you try, you're just never going to escape the OASIS trap that's crushing your agency. You're proud of the care your team provides. You've built something real, but you're exhausted from losing people to paperwork, and you could use a breakthrough. Listen, if you've ever felt like this, let me assure you that you're not the only one. Also, let me tell you, it's not your fault. If you've tried to fix documentation and failed before, that's okay. You see, the reason why your nurses are still drowning in paperwork is that traditional solutions were never designed to actually solve the problem. EMR systems digitized paper forms but didn't reduce the work. Generic AI scribes help with clinical notes but don't understand OASIS complexity. Documentation training teaches nurses the right way, but doesn't change the fact that there are hundreds of data points to complete. Think about it. Asking nurse to document more efficiently is like asking them to type faster on a keyboard that's already broken. The problem isn't your nurses. The problem isn't their training. The problem is that OASIS documentation was designed for compliance, not for clinicians. So traditional approaches can only work if you're lucky. And speaking of luck, if just training harder or buying another EMR module actually worked, your nurses wouldn't still be documenting at 10 p.m. Asking clinicians who already gave everything during the patient visit to give even more of their personal time, or hiring documentation specialists to clean up after the fact, adding cost without solving the root problem, or just accepting 67% turnover as industry standard and budgeting for constant recruiting. After all, I'm sure you have unlimited time and money to keep replacing your best people. You're probably not watching your most experienced nurses consider leaving the profession entirely. You're probably not worried about what happens when the next clinician hands in their notice, right? It's no wonder these traditional strategies didn't give your nurses their evenings back like you wanted. It's no wonder some agencies make it look easy while yours feels like a documentation sweatshop where talented clinicians come to burn out. Until now, that is. Let's stop trying to optimize a broken process and instead step into a world where Oasis documentation is handled by AI, so nurses can focus on patients. Let me unveil the path that transforms a 3-hour documentation nightmare into a 15-minute review. Introducing Copper AI Oasis System, the intelligent documentation platform built specifically for home health that promises to eliminate the Oasis burden, give nurses their time back, and transform your agency into a place clinicians actually want to work. All without asking nurses to work harder or longer, without implementing another complex system that creates more problems than it solves, without exposing protected health information to public AI services, without removing the human judgment that healthcare requires. It seems a little hard to believe, doesn't it? After all, you've tried to fix documentation before, but your nurses are still working after hours. So it feels like too much to hope for, to believe that this could be the solution to 70% less paperwork, 15-minute reviews, and clinicians who actually stay. But this is unlike anything you've ever tried before. Generic AI scribes will never work. They don't understand Oasis requirements, BIM's wording, or the functional items that drive PDGM reimbursement. EMR improvements aren't the answer. They just rearrange the same broken workflow. Hiring more staff doesn't scale. You can't solve a systematic problem by throwing bodies at it. And asking nurses to be more efficient is insulting. They're already working harder than anyone should have to. All of that is history. And in just a few minutes from now, you'll discover how our smart extraction process pre-populates 60% of Oasis fields from referral documents before the nurse even meets the patient. The 5 input methods let clinicians add context, however, works for them. Voice, ambient audio, photos, text, or tap quick select. How our deterministic guardrails ensure zero AI hallucinations with 3,000 plus compliance rules running silently in the background. Our human always in the loop approach, where AI assists but clinicians decide. Nothing touches the EMR without explicit approval. Plus, in just a few weeks, your nurses will experience something they may have forgotten was possible: finishing documentation during the workday and having their evenings free. I know these sound like bold claims, but we've spent over a decade delivering enterprise-grade solutions and automation solutions for some of the most trusted names in healthcare. Organizations like Johns Hopkins, Texas Health Resources, UT Southwestern, and over 100 other providers and systems have benefited from our approach to modernizing operations with AI and smart technology. We've generated $50 million plus in cumulative revenue, serving Fortune 500 clients, including Cisco, Visa, and the US Army, organizations that demand the highest standard of security, compliance, and reliability. And now we've focused everything we've learned on the specific challenge crushing home health: OASIS documentation. The Copper OASIS AI system is transforming agencies. Take a mid-sized agency in Texas that was losing nurses to documentation burnout. Within 60 days of implementing our system, their average start of care documentation time dropped from 3 hours to under 15 minutes. Their turnover rate fell by 40%, and their clinical director stopped spending weekends chasing incomplete assessments. Then there's an agency in Michigan struggling with OASIS accuracy and claim denials. After implementing Copper AI OASIS system, their accuracy index exceeded 96%. Correction cycles dropped 75%, and their QA team shifted from catching errors to improving care. And a growing agency in Florida that needed to scale without proportionally scaling their documentation burden. With our system, they onboarded 30% more patients without adding administrative staff because nurses could actually complete documentation efficiently. With agencies across the country seeing similar results, it's possible you could be next. Let me walk you through how our system works. Step 1. Smart extraction, pre-visit. When a referral PDF arrives, our AI reads the HNP, medication list, and clinical history before your nurse even meets the patient. 60% of OASIS fields are pre-populated with suggested answers. Your clinicians walk into every visit with a head start instead of a blank form. Step 2, multi-input collection, during or after visit. Clinicians add context through whichever method works for them: voice dictation or ambient scribe, photo capture of handwritten notes or cheat sheet, two-way AI conversation, tap, quick select interface. We don't force your nurses into a single workflow. We adapt how they actually work. Step 3, review and approve. Post-visit, the clinician reviews AI-generated answers, makes any corrections with simple taps, and approves. Average review time, 5 minutes. The completed assessment pushes directly into their EMR, WellSky, CanTime, or whichever system you use. That's not all. Built-in QA runs silently in the background. 3,000 plus compliance rules catch errors before they become denials. No more QA teams playing whack-a-mole with documentation mistakes. No more claim rejections from OASIS coding inconsistencies. Human always in the loop. AI assists, clinicians decide. Nothing goes to the EMR without explicit human approval. This isn't just good practice. It's how healthcare AI must work. Private LLM infrastructure. Protected health information never touches public AI models like ChatGPT. We run private HIPAA-compliant infrastructure with SOC 2 Type 2 certification. Your patient data stays protected. Imagine this scenario. Your nurse completes a complex start of care visit. Normally, she'd be looking at 3 hours of documentation tonight. Instead, she opens the Copper AI OASIS system. The referral data is already extracted. She confirms a few items with quick taps, adds voice notes on what she observed during the visit, and reviews the AI-generated assessment. Total time, 7 minutes. She's home for dinner with her family, and she's not thinking about finding a new job. The best part, this isn't science fiction. This is what our system delivers every day for agencies that made the switch. Here's what our clients say. Our nurses aren't drowning in paperwork anymore. The system catches issues before they become problems. Home health agency in Texas. That's what they said. Another one said, our back office now works like it's got a second brain, but one that doesn't sleep. That was the group in Florida. And the one in Michigan, from 3 hours of starter care to 5-minute reviews. I didn't think it was possible until we saw it. and that is even a doctor. And if we've done such an excellent job for these agencies, imagine what we'll do for yours. Well, the only catch is this. Because we're building something specifically for home health, not adapting generic AI, we're focused on working with agencies who are serious about solving their documentation problem. We can't work with everyone. We're looking for agencies who recognize the status quo is unacceptable and are ready to give their nurses their time back. So I invite you to go below this video now and book a call to learn more about the Copper AI Oasis system today. While you're booking your call, you'll answer a few questions that help us understand your agency's specific situation and make sure we're the right fit. Remember, every week you don't fix this. It is another week your best nurse considers leaving. It's another week of 3-hour starter care completion at kitchen tables after kids go to bed. It's another week of turnover costs, training costs, and the invisible cost of losing institutional knowledge. When experienced clinicians walk out the door, what would another year of this look like? How many more nurses lost to burnout? How many more evenings stolen from people who just wanted to help patients? How much longer can you afford to wait while other agencies figure this out? But all of this can be avoided today simply by going below this video and booking a call with our team. I'd like you to imagine something with me right now. It's 30 days from today. We started working together around a month ago. It's already happening. Your nurses are completing starter care documentation in minutes instead of hours. They're finishing during the workday. They're not exhausted. They're not frustrated. They're not updating their resumes. Your clinical director checks the dashboard and sees assessments flowing through cleanly. QA flags are rare because errors are caught before submission. Go with me just a bit further. 60 days later, and now your agency looks a lot different than it did just 2 months ago, doesn't it? Your turnover rate has dropped. Nurses who were considering leaving have decided to stay. Your clinical time is focused on improving patient outcomes instead of chasing documentation. Recruiting gets easier because word spreads that your agency respects clinicians' time. And you start transforming from running a documentation factory to running a healthcare organization. And it all started right here, right now, today, when you made the decision to stop accepting 3-hour starter care and give your nurses their time back. Go below this video and book a call to see if the Copper AI Oasis system is right for your agency. Thank you.